My name is Ben Humphreys, and I'm Chief of the Division of Nephrology at Washington University in St. Louis and past President of the American Society for Clinical Investigation. And I'm absolutely delighted to be here today to interview the recipient of this year's Korsmeyer Award, Dr. Kimryn Rathmell. The Korsmeyer Award is particularly special in the ASCI because it values equally the recipient's scientific accomplishments as well as their legacy of mentoring. And over the next 20 or 30 minutes or so, I look forward to hearing from Kim on both of these topics. So Kim, welcome.
Thank you.
If you could just take a minute and tell us a little bit about yourself before I dive into the questions.
Sure, thank you. So my name is Kimryn Rathmell, and I'm a physician scientist. I focus my efforts on kidney cancer. That's a passion project that I've been interested in really diving into for the last 20 or 25 years, both scientifically and how to improve the lives of patients. I'm most recently the director of the National Cancer Institute and have spent most of my career in academia working as a medical oncologist with the developing physician scientists, as well as a division chief, a department chair, working across healthcare sector. And my next step in my career, which will start in about a month, is moving on to the CEO of the Ohio State James Cancer Hospital.
Well, congratulations. We're very excited for you.
Thank you.
Just to start, perhaps, could you tell us a bit about how you came to focus your research on the mechanisms and biology that drive kidney cancers?
Yeah, it's one of those stories that's a little bit serendipitous. So I was always interested in how normal cells can go awry. My PhD was studying DNA repair, but really studying how normal mechanisms that keep your cells safe get switched into causing your cells to go and become cancerous or damaged in other ways. And when I became a fellow, I was looking for some similar opportunity and area of interest there. And it was just at the time that the discoveries of how hypoxia signaling, how our cells respond and sense levels of oxygen and enact programs that can survive a period of deprivation, are actually usurped in cancer. And kidney cancer happens to be the hallmark cancer. This is a mechanism that's relevant for many, many cancers. But in kidney cancer, there's a hardwired switch that turns on the hypoxia program. And so this is a normal response that is a perfect storm, turning on changes in metabolism, changes in angiogenesis, changes in how cells choose to survive or die and migrate. And I just found that a fascinating area to dive into. I mean, other people did too. The Nobel Prize was awarded for this discovery. So I was a part of that cheering squad. But what really happened was that at the same time, I was looking at how to become relevant in the clinical space, seeing a lot of patients with kidney cancer, and those patients had nothing to be offered. High-dose interleukin-2 was approved, but very rarely given. The opportunity for it to have an effect was very, very minimal. Most patients were referred directly to hospice. That was my role as a doctor. And so it seemed like a rich opportunity for the science to drive some improvement. You had so much room for improvement. And that actually really played out for many years, being quite separate between trying to make advances in the clinic from what was happening in the laboratory, but they've gradually become much closer. And today, kidney cancer is a completely different story. And the kinds of ways that kidney cancer can be treated, even cured, it's just phenomenal. So it's the dream completely realized.
It sounds courageous a bit, because if there were so few treatments at the time, did you worry that it was risky to go into this field at all?
Yeah, that's a good question. It was risky only in that there was no one else in that field. I distinctly remember several conversations where I said, "Oh, I'm going to be a kidney cancer doctor," and being told, "You won't have enough volume of patients. There's no community to be a part of. You have to be a genitourinary cancer doctor," and that's what I essentially was. I saw a lot of prostate and bladder and testicular cancer, but I got to see all the kidney cancers.
Yeah.
And then as the therapies started to come on, and then suddenly patients were living longer, then my clinic shifted because there were kidney cancers to see. And so it was much less risky than I thought it would be. But I wasn't terribly worried about the risk because as a physician scientist, my major focus was in the laboratory. And there was so much to do in the laboratory.
Yeah, that makes a lot of sense. What factors do you feel have been most critical to your success in the lab?
I think the success that we've had in the laboratory is it almost always comes down to what people you work with. The laboratory is an ecosystem of students and postdoctoral fellows and other scientists and the collaborators that we've had. So it's having people who challenge you to think really creatively. We've gone in lots of different directions. We sometimes have described the laboratory as the blind men and the elephant. We have done everything from angiogenesis and chromatin biology to tumor microenvironment and transcriptomics, because based on the talents of the individual, the interests that they had, or what was ripe at the time. So it really was, the people that drove it. But I think the other piece is that we were always quite closely tied to the clinic. Even though we are not a traditionally translational laboratory where everything is kind of clinic focused, we went out of our way to try to move as quickly as we could into questions that we could address in patients. So whether it was using imaging modalities or studying tissues, it added to the relevance and often took our experiments in different directions that we might not have expected had we stayed in the model systems. So it was the combination that really helped us to find some of the answers that have been the most surprising and the most impactful.
I'm sure the science took you to all these different areas in cancer biology, but also perhaps the talents and personalities of your trainees and matching them the other way around.
Yeah, that's a story we can tell over and over again. It's, people come in and they're really fascinated by some aspect. And as a mentor, you have to help, guide them. It has to fit. We have to have funding for it. It's not sort of a free reign candy store, but it's trying to marry what really gets them passionate. And I've also seen over and over again people who maybe appeared somehow, not to have the drive or passion. But once they found something that they were interested in, then they go, because then it's fun. Yeah.
Where do you see your work going in the future?
That's a good question, because we could go in a lot of potential different directions. Number one will depend a lot on what the lab is composed of. So I mentioned that there's a move coming up, and it depends who comes. I could easily see us staying in metabolism. That's, I think, an area that's just really rich to understand, how we could influence metabolism to change the way the immune microenvironment interacts with the tumors. I think immunology, also, I'm not an immunologist, so that's an area that I would go to if I had a scientist who wanted to work with me, who comes with the strong enough background to really dive in there. But I think that's where the gold mine's been. That's where we're starting to see real cures affected. But when I was at the NCI, we really got very much more interested in the rare subtypes. So kidney cancer, we say kidney cancer, and we're mostly meaning clear cell renal cell carcinoma. That's 75% of tumors, but 25% is a whole laundry basket of 20-some different subtypes. And the knowledge there is where we were 20 years ago. And so I would love to, with the luxury of now experience and some more grounding, to be able to take on one or two of those rare subtypes and help them get to the place where clear cell is.
I can see how exciting that would be, having been on the road that you've already been on and seeing the impact you can have in one particular type of cancer. I want to switch to mentoring and just ask you, how have you approached mentorship in your lab and during your time as department chair and your other leadership roles?
Yeah, I think of them very similarly. And it's nice the way the career arc works from learning how to run a laboratory, to learning how to run a bigger team, to learning how to run a division, to a department, to the National Cancer Institute, right?
Yes.
It's in the laboratory. I mentioned this already. It's really working with someone to help find what is really most exciting to them. And we usually start with a project and then allow it to percolate for a little bit, and then define it more, a few months down the road. I think there has to be an element of patience. That's also true at some of the higher levels of mentorship as well. For me, it's really important to know the team very well, for us to be able to be candid or transparent or honest with each other, so that we can, with a little bit of time and probing, know where people's sweet spots are, where they can have the biggest level of impact. I like to run a team that has the opportunity for everyone to be able to bring things up, a much more sort of collaborative style of leadership that probably comes from, that's how I run the laboratory.
Right.
So that's how I operate.
Do you feel like that team building is important so that your trainees can feel comfortable sort of challenging each other and making ideas incrementally
100%. I think the thing I love about science and medicine is that we embrace that, or we should. And that's where if a laboratory member, challenges a thought or an idea, number one, you have the opportunity to find out that there's something you didn't expect at all, and that's the most fun. So you don't get that if you just say yep, we were right. You get much better answers if you're like, I think that's wrong. Like, what else could it be? I've had some. I think I was lucky that one of my very early students, my first student, was able to show the way of how to be really to push that. So we had made this mouse model. We were just getting started. Mouse number 5. I still remember this. We have so many slides from mouse 5. Mouse 5 had lots and lots of cancers, and we're like, we have hit the jackpot here. And so we just have to do a few more, and we'll know. And she really rigorously did the numbers, really went through every kidney, every tumor of hundreds of mice to prove that we were wrong. But in proving that we were wrong, helped us see that there was actually some other very interesting biology to understand. Had we not had her sort of willingness to speak up at an early stage in the laboratory, it might not have set up the culture that it's very okay to speak up. Yeah. Also, the people who are working, right there in the spaces, they see what's happening, right? I want them to be able to say, I'm seeing this something unusual under the microscope. Sure, it's possible that it's some artifact and we need to fix the scope, right? But maybe they're seeing something that's completely new, and we've encountered that as well. The other story that I'll tell is, one area that I'd love the laboratory to keep going, but it would really take the right person to join us so we could keep collaborating. I had a scientist in the laboratory who was a really good cell biologist, and we were looking at DNA and looking at chromatin patterns and cellular division, and he was able to observe that it looked like there were chromosomes that had 2 centromeres, which is wrong. You're only supposed to have 1. And at first you think, oh, that's an anomaly. Oh, there's a million reasons why it's not real. And he then developed the technologies that we needed in the lab to be able to really interrogate that. And it turns out, in fact, it happens. And it happens at a level that's not insignificant. And once you see it, you can't unsee it. But we never saw it for the first many years that we were looking at these unusual cell divisions. We were seeing breaks, and we were seeing chromosomal bridges, and not having a clue why they were there. And so it was his really discerning eye and completely changed the direction of the lab. I'd love to continue to collaborate with him. He has his own laboratory right now, so that work continues.
We're in a remarkable time in biomedicine, and the physician-scientist career path is so rewarding.
Mm-hmm.
We're also in 2025, and it's a challenging time for academic medicine. Yeah. How do we best encourage our early career physician scientists to continue on this wonderful path?
Yeah, I think that's the really, really important question, because it is a incredibly valuable place to work between patient care and discovery science. We are not mechanics of the human body. We're inventing the space for health, right? So when it's so challenging around funding climates and other external pressures, it can be easy to choose alternative careers. And so I very much worry about our workforce. So my encouragement to people who are interested in this field is we need improvements for human health. There is a lot left to discover. We're at a place where the opportunities to make those discoveries that are really impactful happen much, much faster. It's in ways that can, change the course of diseases in not lifetimes, but in time you might measure in months or years sometimes. And who would not want to be a part of that? And so if that is the thing that drives someone, physician scientists have always been here, and through the challenges that are ahead, mirroring those that have been behind us, that this is still a field that will be here for us. So I really encourage people to stick with it, find good mentors, find people who will support them, find teams where they can do the work that they want to do, to be a little bit flexible in how things happen. For even in the best of scenarios, this is not a menu of things. This career path involves a lot of being willing to think differently, to have someone challenge your ideas. That is a part of it. And so kind of accepting some of the flexibility that gives us resilience to work in this really fascinating space. So.
Well, Dr. Rathmell, congratulations again on being the 2025 recipient of the Korsmeyer Award.
Thank you.
Thank you for sharing your stories. I'm sure they will be as inspiring to many others in years to come as they have been to me talking to you just now. So thank you.
Thank you very much.